Hello and welcome back to the EMJ Gold podcast, brought to you by EMJ, your number one open access destination for HCPs and pharma globally. Hi Jade, welcome back to another episode.
Thank you. How are you doing today?
Very good, just about recovered from the EMJ summer party on Friday.
Yeah, it was a good one, but we're back in the studio bright and early, ready for today's episode.
Yes, back to business indeed. So today we're going to be sharing an episode that I recently recorded with Shish Patel, who is the medical director at Chiesi UK. He actually started his career as a pharmacist, holding roles at both GSK and Sanofi, before moving to work for Chiesi over 20 years ago.
Yes, that's right. And at the company, Shish quickly established himself in medical affairs, with previous roles including head of medical before he did take on his current position in 2019. He's got a special interest in the field of respiratory medicine, which I know is the main focus of your conversation today, more specifically the rising burden of COPD and the impact of respiratory disease on the planet. So it sounds really fascinating. I'm excited to listen.
It is. It's a really interesting topic, which was great to actually have in person in the studio. But without further ado, I think let's listen in.
Let's do it.
So, Shish, welcome to the EMJ Gold podcast. It's lovely to have you in the studio today. How are you doing?
I'm doing great. Had a great trip down. Wow, what a stunning view of London from here. Couldn't be better.
Thank you so much. As for context for our listeners, we are riding above the Barbican at the moment. It is quite a spectacular view from here. We're very lucky in the studio. We'll try not to get distracted throughout the interview. So really looking forward to speaking to you today on a topic that I think is a really, really important one. We're going to be touching on COPD and the relationship between respiratory illness and also the environmental impact of respiratory care. So some really interesting topics that I'm very pleased you're here to talk about, Shish. But as we do, before all of our podcasts, I want to know a little bit more about you first and what attracted you to working in this sector. So it'd be great if you could tell us a little bit about that and maybe why you decided to specialise in respiratory.
Sure. Isabel, I'm a pharmacist by background. I qualified to practice in community pharmacy, and that's where I saw people living with respiratory diseases being managed suboptimally, despite the fact that there were both good pharmacological and non-pharmacological interventions. And that interest really graduated over time to looking at climate change and the impact on the prevalence of respiratory diseases and the increase in severity of those diseases. And certainly when I then transitioned from my community pharmacy practice to the industry, it was helped by the fact that Chiesi is a family-owned organisation that enables me over a medium and long term to work on scalable actions that impact a broader range of people living with respiratory diseases compared to working in a community pharmacy.
That makes complete sense. And yeah, thank you for sharing that context around what sparked your interest in this area. I think you touched on it a little bit there, but COPD is one of the most misdiagnosed or underdiagnosed conditions. So what do you think we can do about that? How can we fix the diagnostic gap? What advancements in medicine are there that are maybe not being taken advantage of? And also, what needs to change to really address it?
Okay. So I want to share something with you. Over 1 million, in fact, 1 to 2 million people are potentially walking around with the condition of COPD and they don't know it. And COPD is one of those conditions that progresses over time. Some of those people living with the disease will end up in hospital. Once you have an exacerbation, 50% of patients that have had a hospital, they've been hospitalised because of an exacerbation, are probably not going to live beyond 3.5 years, and it's a very sad statistic. So certainly something needs to be done about it, and I think it's the fact that there's a lack of awareness and education, both in terms of with healthcare professionals and with the public, in terms of having the awareness of COPD. What we'd like to do about it is, beyond the education, is to look at pathways, and certainly they're targeted cases. That's something that that we advocate, and targeted health checks is something that's operated in a number of disease areas: cardiovascular, diabetes, and respiratory care. In respiratory care, we got the targeted lung health checks, and certainly those have started to have an impact. In fact, we've been working with Hull University NHS Trust on the Frontier collaboration. And what we found in terms of bringing people in living with respiratory diseases to that program is that we're able to diagnose over 70% of patients initially. Now, that will average out over time to around 50% as less severe people living with COPD come through that particular program. But it's quite a striking statistic and a high statistic of undiagnosed COPD out there. And certainly, if they're undiagnosed, then they're going to have a big impact on healthcare utilisation. In fact, the statistics say that a person that's hospitalised with COPD will occupy a hospital bed for up to 7 days. And the cost to the NHS of COPD in general is about 1.9 billion. So we want to take the learnings of Frontier, and certainly that was in a secondary care setting, and we're now working on a second project called Comet, which brings that into a community setting. And related to that, and targeted lung health checks, we've got some great news recently that was announced from NHS Wales. They piloted lung health checks in 2023, and Chiesi were aware of that, and Chiesi worked on a communication around the learnings of that, and quite recently that were published. And what we found is that the government recently announced that from 2027, they're going to kick off a program of lung health checks that will include identifying lung cancer and COPD. So great news for the people of Wales.
That's really good news. I hadn't heard of that, but that certainly seems like a step in the right direction for patients and people working in the field. What I want to touch on now is around the mental health impact of COPD. As with any health condition, I think there's always a mental health impact. And this particular condition has a huge impact on quality of life and healthcare systems as well, of course. So how do you think that the healthcare landscape needs to adapt in order to better sort of support the experience of patients and help them to better manage these symptoms so they're not as debilitating?
Of course. So I think you're absolutely right, Isabel, that COPD doesn't just affect the lungs. It affects mental health. It affects a person's well-being in terms of social isolation. And as a result of that, those people become withdrawn, don't seek help with their symptoms and medication, and they progress. Unfortunately, COPD is one of those conditions that can lead to hospitalisation. So ultimately, it becomes a burden on the NHS. But how can we help? I think as a society, I think we need to accept that lifestyle component is part of a number of diseases: cardiovascular, obesity, and COPD. And I think moving away from judging people with these diseases is quite important, and moving society in a direction that will be more empathetic will help then those people with living with those diseases feel more included and therefore empowered to manage their condition. And certainly if we don't do that, those people will be isolated, and will be an increase in economic burden and resource burden on society otherwise.
Well, clearly an issue that would be very deserving of a solution, and you raised some really good examples there. I guess another challenge in the respiratory space, both in terms of how people contract these diseases, but also the impact the treatment of them has on the environment is definitely a sort of dual issue. So while healthcare innovation must prioritize immediate patient benefit over, protecting the planet, fundamentally, that's what you guys are here to do. What are the environmental challenges that are specific to the respiratory space?
Yeah. So I think it's the carbon footprint overall, right? That's a challenge. When we look at the health sector globally, if you calculated the carbon impact of the healthcare sector on the environment, it would be the equivalent of a country that's ranked 5th in the world.
Yeah,
so that's how much it is,
yeah.
So I guess that there's an onus on all pharmaceutical companies to look at the whole life cycle of their product ranges and start to work on reducing emissions along the whole pathway. So certainly for Chiesi, that's a real focus, and it's a real focus because we're a shared value organization. What that means is that we don't just make a decision for our business. We make sure that that decision benefits people living with respiratory diseases. It benefits the communities that we serve, and it benefits the planet. And as a result of that way of doing business is that we've got an ambitious net zero target for 2035. In that target, what we want to do is 3 things. We want to use 100% renewable energy. Secondly, we want to electrify all our car fleets. And then thirdly, we want to look at our respiratory care products and ensure that the propellants that we use are carbon minimal propellants. And in fact, we've invested in that particular innovation, and we've just completed trials, and those trials will result in a 90% reduction in the carbon footprint of our respiratory care portfolio. So now that we've finished those trials, the next stage is registration, and thereafter we'll be able to initiate the rollout of our portfolio.
Sounds really exciting, and I hope lots of other companies are doing the same, and if they're not, they are making plans to as well. I suppose, it's great to hear what you're planning on doing now, but you would hope that there are even bigger goals up ahead in the future. So how can pharma do more to balance the urgent needs of patients with their responsibility to reduce environmental impact?
Yeah, I guess I might have touched on this already a little bit, but I truly believe that they need to look at the whole life cycle, and I think there are real opportunities to do that in terms of so if I take Chiesi's example, we've put a £350 million investment in innovation with our carbon minimal inhaler and the carbon minimal propellant. Alongside that, we've looked at smaller innovations. So we've got a product in the area of neonatology where we were able to just change the packaging from plastic packaging to paper packaging. So it's about making both small and large changes.
Yeah, that really comes across. I suppose it doesn't always have to be the grand gestures. It can be the case by case that really makes the difference. So it's been lovely to cover the topics that we've covered today in terms of COPD, environmental impact, and respiratory illness overall. But Shish, I would like to now bring it back to you to conclude the episode. When we first talked about doing this podcast, it was a little while ago, and we're now nearly halfway through the year. So I would love to know what has been your proudest moment so far, either professionally or personally, and what you hope to achieve before the year is over. 6 months to go.
Yeah. I think our proudest moment so far is the number of collaborations that we've got off the ground and progressing with in a number of areas of our business, and collaborating with the NHS needs to be at the heart of what we do over this next certainly this next 12 to 18 months, and my main ambition is to make sure that these collaborations have a lasting legacy. I think what we don't want to do is have pilot collaborations that then fall away. We want them to make a difference to patients in the NHS.
Perfect. Well, Shish, thank you so much. Really appreciate you joining me for the podcast today, and we'll have to have you back another time. Thank you very much.
Thank you.
I really enjoyed listening to that conversation, Isabel. As ever, have you got a favourite moment you'd like to pull out?
I do. I really enjoyed what Shish was saying about COPD. I think it really struck me, his explanation of the diagnostic gap. So he shared that up to 2 million people could be living in the UK with the disease without knowing it. And this is often because GPs don't have the right tools to necessarily diagnose every single case. And I thought that was really interesting and important to note. What also struck me, though, was he was talking about the additional initiatives that Chiesi are working on. So I think there was one called Frontier and one called Comet. Really great action to be taking, and it would be great to see more initiatives like this being rolled out more widely.
Yeah, absolutely. I think it's really encouraging to hear about those kinds of practical interventions being at scale as well. One thing I found really powerful was when Shish was talking about the environmental impact of respiratory care as well. He shared that if the global healthcare sector were actually ranked as a country based on carbon emissions, it would be 5th in the world, which is quite a staggering statistic. It was also really interesting to hear about how his team are tackling that, from, investing in a carbon minimal propellant for inhalers that could cut emissions by 90% to switching to renewable energy, electrifying their fleet. Yeah, just all great examples being seen.
Absolutely. Well, thank you very much to Shish for joining me in the studio for that episode, and thank you to you for listening. But I think that is all we have time for this week.
So as well, do be sure to come back again next time for another great episode. But until then, it's bye from us.
Bye.